If I walk in the door and say, okay, let me walk you through this self-funded plan, people will be like, okay, this is going to be a bunch of spreadsheets and numbers that I have to figure out how to understand. Or I could say, hey, here's the problem I see in healthcare access today. And here's where I believe the employer responsibility lies. Here's where my responsibility lies for you. And how would you like to change that?
Welcome to Healthcare on Trial, the podcast for anyone ready to stop accepting a system that was never designed to work for them. Ed, thank you so much for being on. I'm so excited to welcome you to be on Healthcare on Trial. I'm the host, Kristen Rivers. I am going to pass it over to you, Ed, to give the audience a little bit of an introduction on you, and we'll get into it.
Awesome. Thanks, Kristen. It's exciting to be here, and just great to see you as well, by the way. So yeah, Ed LeGande, I'm a partner. I'm a market director with Nava Benefits right now, and I've been in this crazy business about 17 years now. I woke up in January like, how have I been doing this for so long already? I guess all the gray hairs kind of give away my age at this point.
I don't see any. You're
good. Good filter. Good filter. Yeah. So yeah, hyper focus on just helping employers become an employer of choice, honestly, and striving to help them find that great intersection of plan design and cost, but with a really strong focus on both employer and employee education along the way. So.
What got you into it 17 years ago?
I mean, when I was a kid, I knew I wanted to be a broker, right? No.
There are kids who go to school for risk management now.
They do.
We have a few on our team. It's pretty crazy.
Really? Yeah. Well, congrats to them. It definitely was not that for me. I didn't know what I was getting into. To be honest with you, 2 or 3 years into this industry, I still didn't think I knew what I was really getting into. Fell into it by accident, which I feel like 98% of this industry is.
Me too.
I played soccer in college. Right after that, going pro just didn't make sense anymore, especially due to some injuries. So I went into financial advising. Well, who thought it would be a great idea to go into financial advising in 2007, 2008, when an economic downturn, and they're going to listen to some kid with dreadlocks coming out of college? Yeah. Yeah.
I would have, just for the record.
That. Yeah, I appreciate that. I did have some success, though, which was actually the funny part. But, that individual sale just wasn't for me. And trying to push, life insurance and things like that just didn't feel great. And so I actually wanted, because of my injury, I got really interested in medical device sales. And I remember because my surgery, I had surgery on both of my legs. I have titanium rods inside both of my tibias, actually.
Okay, now you have to tell the story of this injury, Ed, before we get into medical devices.
Yeah. So as I mentioned, I played college soccer, which was an incredible experience, but I was just injury riddled like crazy. It was incredibly frustrating. During what I would say is my peak, when I was, of course, it's when you're playing your best, you're feeling your best. There was a little bit of overuse in my body, I believe. And some of it, I think, was my own fault, just doing triple days, trying to just get better and better, especially because I could smell going pro. Like it was starting to become real, a little bit here and there. And so I had a really bad tackle in one of our training sessions. And of course, this training session, our coach said, hey, this is a showcase training where we had a lot of young clubs coming to watch us train. They wanted to see what elite level soccer players do. And so, there was this level of energy at practice, like push through pain, show these kids what being a tough athlete's about. But I had a really tough tackle in practice. One of my teammates tackled me pretty hard, unintentional, but I kind of flipped in the air and landed. And for like 3 or 4 days straight, I just couldn't really walk on my left leg. And finally get an x-ray and end up finding a crack in the middle of my tibia, but also like 6 stress fractures along my shin. And so we ended up finding out after doing tons of blood tests and things like that I'm vitamin D deficient, which everyone is. But what we didn't realize is that I'm also immune to supplements. So drinking all the milk to build up my calcium and things of that nature just didn't help. But after a considerable amount of PT and things like that, it did start to heal a little bit, but the pain did go away. The next year, started getting back up to where I was before. And then I took one step during one game and felt the same pain that I did in my other leg the year before. Oh. And it was like a little bit of PTSD. Immediately asked for an x-ray after the game. 3 or 4 stress fractures in the other leg. And these ones were deep. I was told we actually went to the national team doctor, and he told me, leaving this office, your leg could snap walking down the stairs. That's how bad these stress fractures are. My dad came with me, and
Carried you, hopefully, or
he helped me down the stairs, but obviously that messed with me mentally, right? And so within a couple weeks, we did a surgery where I had both of my kneecaps kind of open, not to get too graphic, but titanium rods inserted in both of my legs.
What you're describing, I feel like shapes you for the rest of your life and your career. While that competitiveness that you had on, I want to be better, I think how much harder it was for you to get to the level of where you were on, like, one of the most elite players in soccer, and having clubs come and look at you. Think of how much harder you had to work with the unknown to you at the time, the vitamin deficiencies, the inability to absorb supplements. That was like, you still achieved what you achieved, even though you had something holding you back, and that kind of shapes you. And we do it from like a mental perspective now for stamina. I mean, I know how hard you work, so I'm saying this for you right now. Like, we now have carried that into our professional lives, right? Yeah. When we see the precipice of success or the next bar of success that we're building for ourselves, the 3-a-days kick in, and the, lack of sleep and the excessive travel and all the things, which I'm sure we'll get into shortly here. But I think it shapes who you are. And even though it led you down a different path, Ed, I think that's probably a part of your life. In that moment, it was probably like the worst thing. But looking back on it, it shaped who you are today.
I think you're right about that. It's funny. When I went into college, I didn't want to play college soccer. It's the funny part. Never wanted to play college soccer. My parents were like, "You're playing college soccer," and so of course, you got to listen to your Haitian parents, or else you're in big trouble. So, no, but I was obviously extremely fortunate to play there and had some great teammates along the way. But I changed my mindset from, okay, I have to play soccer, to look at this amazing opportunity. I'm playing at a top 10 school nationwide. This is incredible experience, and I'm also going to a really cool school. I'm playing against elite athletes, and getting a great education along the way. And then when I changed my mindset to, I'm going to take this as an opportunity to level myself up, right? And so maybe this is the right path for me. And so I started believing all that, and then it felt like it all came crashing down. And, I don't know that I knew what the term depression meant at the time, but I struggled big time.
Absolutely.
Yeah.
You finally came to terms with what your path was going to be, or the path that had been kind of shaped for you, and saw success, and then was sort of taken by something that was outside of your control 100%. At the time. So that then led you into getting interested in med devices.
Yeah.
Based on the rods that were placed in your legs. Oh my goodness.
So the surgery I had was so infrequent. I was told that by the orthopedic surgeon, that they decided to film it for like studies for students and things like that, with permission from my parents and such. And so I, due to my curiosity, my mom's in the medical industry herself. She's a family nurse practitioner, and my dad's a chemist, actually. And so they have just scientific backgrounds. And so they were also intrigued. So I got to watch parts of the surgery. Now, I don't ever recommend that for someone, because that was just so awkward to see your own body kind of opened up a little bit like that. But there was someone standing in the room that was interesting to me. They were obviously all scrubbed up, but they were the ones kind of working with the devices. And so I remember asking the orthopedic surgeon, what role is that individual? Mm-hmm. And he told me, oh, that's our medical device rep. He kind of shared, and I started researching that industry and realized, oh, this is a way I can kind of get into the medical industry and maybe stay around sports medicine to a degree, without having to go to med school per se, right? And so
you didn't want to take another 10 years in schooling?
No, unfortunately, yeah. School was great. Stay in school, kids, but it wasn't for me.
Gotcha.
Yeah.
So where did you end up going to work for a med device company?
So in looking for that, at the time, I think things are very different now. They wanted 2 years minimum of business to business sales experience. And I had business to consumer sales experience. Literally, that justification was the only reason why I couldn't get past like the second or third stages of interviews. And so it was a little frustrating, but they were telling me, hey, you have all the the ingredients to be great at this job, but we need that to just get you across the finish line. I'm like, okay, so go work for a Paychex or an ADP or something like that, get a couple years of sales experience with businesses, and then, let's apply you. I was working with a medical device recruiter at the time.
I mean this really respectfully. It's usually the worst way to start a statement. It sounded like they didn't want to do the training because like the ADPs and the Paychecks of the world have pretty rigorous sales training programs.
Yeah.
Sounds like they wanted the training done before they got you started, but I don't know.
Well, it's funny you say that because after I started hearing about this, I realized there weren't really any training programs that existed, which also led me to believe, or basically when I got into this business, the benefits industry is kind of the same thing. I mean, hopefully you have a good mentor.
Yep.
But really you're on your own to try to learn everything.
Absolutely.
Yeah.
So you're talking to this med device recruiter. They sent you in the direction of maybe going somewhere else to get this training.
Right.
And is that where'd you end up after that?
Yeah. So I happened to have dinner with a good friend of mine at the time, and he was a benefit advisor and said, hey, don't work for Paychex or ADP. I had an offer in hand from Paychex actually that I was going to accept. And he said, why don't you come and work with me? You get to work with a buddy for a couple years, and then you can go do that if you don't like it. But at least it's business to business. And since I was already life and health licensed, I said, hey, might as well put that to use. And I took a leap of faith. I took an extremely low salary. My parents weren't happy about that either. But just took a leap of faith. And that's how I got into the benefits industry. It was just kind of following a friend into it.
Gotcha. So, what role did you start in?
So it was called account executive, but I was really a sales person. But when I got in quickly, I realized how much I didn't know. So you were saying, when you get into this business, understanding HMOs and PPOs, I specifically remember one drive we had. We had a 2-hour drive to a client of his, and he was explaining to me what an HMO was, what a PPO was, what an HSA was, so that I could sound somewhat informed when I got to the meeting. Yeah. That was my training, was sitting in a 2-hour drive in LA traffic.
Yeah, it's funny that you say all this because there's so many parallels that lead you down a path. I don't know if I agree with the recruiter you were working with at that point in time, but like people give you interesting advice that leads you down a path and shapes where you end up, which in retrospect, it all worked out well.
Very much so.
But at the time, I don't know. So I, because I was at United Health Group before Pareto, I was at a pharmaceutical company before that. Okay. And it was title insurance into civil litigation into pharmaceutical company. But they had me through, I was in the dermatology division, neurology, cardiology, and learned, went and trained. You do a quick 2-week or 1-week training on the product, and then you go out and you sell it. So I got thrown out of doctors' offices for a living, if you call that business to business sales. You have to get really creative on getting an appointment with a dermatologist to actually get to pitch your product. But same thing, switched over to United and really didn't really understand benefits, which this isn't about me. But I'm agreeing with what you said. And I remember going over to, I was in the office and I was no idea what's going on. Yeah. I'm in sort of a pseudo chief of staff role to the leaders of the large group department, which I had no idea what that meant. There was one, very senior, a managing consultant essentially on the carrier side that just had every big account. He had the AT&Ts, the Edisons, the whoever's of the world, was writing these creative, self-funded HMO plans. Wow. And I just went over and was like, can you explain the difference between the products to me? Because there's too many and I have no idea what's going on. And second, can I just sit and learn? Because I don't think I know what's going on right now. And that was my training. Similar, it's like the car ride you were taking with your buddy. Yeah. I had to go find a buddy and say, can I just meet with you and learn from you and sit on the side of your desk and figure out what the heck is going on?
100%.
There was no training.
But you had to ask for it too.
Yes.
Yeah. I mean, and you think about, I almost want to relate that to just the average American these days. They don't know those. They don't
Yeah.
know the differences between all these. I call the benefits industry just acronym city.
Yeah.
It's just acronym after acronym. And I think sometimes we are so used to talking to each other about it with a certain level of understanding, we expect other people to just kind of know what we're saying.
Healthcare is one of the largest and fastest growing expenses facing employers today. Yet billions of dollars are lost every year to billing errors, unnecessary charges, waste, and a lack of transparency. Most plan sponsors never know where those dollars go. That's why US Beacon exists. We believe every healthcare dollar should be accountable. As an independent medical and pharmacy claims auditing and review firm, we work exclusively for employers and employee health plans, not insurance carriers, hospitals, or providers. Our independence allows us to follow the evidence where it leads, uncovering billing errors, payment discrepancies, contract compliance issues, and opportunities to reduce unnecessary healthcare spending. Our mission isn't simply to identify and recoup savings. It's to restore accountability to a healthcare system that too often operates without it. We help plan sponsors understand where their healthcare dollars are going, protect the assets they've entrusted to their health plans, and fulfill their fiduciary responsibility to the employees who depend on those benefits. That's why we're proud to sponsor Healthcare on Trial, because informed employers make better decisions, transparency creates accountability, and when accountability exists, healthcare works better for everyone. US Beacon, when healthcare is on trial, the evidence matters. Yeah, I was in a seminar yesterday, and there was about, like, I'd say close to 300 employers in the room, and there was a assembly line of speakers throughout the day, and just listening to them rattle through the information they want everybody in the room to know and hear about and absorb and understand, things around fiduciary compliance and what their responsibilities are, and running through the history of the healthcare industry. And you just see every person in the room. And these are very intelligent people, CEOs, CFOs, heads of HR, benefits leaders within companies, listening, and they're not following, because I think maybe the military is the only other area that has more acronyms than we do in the benefits industry. They were glossing over. So I had to do a little recovery by the time I'm getting up there, post-lunch time slot, I just went the route of trying to get them, worked up, but not saying things like PBM, but saying your pharmacy benefit manager who handles the movement of money and contracting. Yep. They're not necessarily handling the drugs unless they own the pharmacy or the specialty pharmacy. Wait, I'm sorry. There's situations where a pharmacy benefit manager owns a pharmacy or the specialty pharmacy. Yeah, let's talk. That's what we were talking about, vertical integration. We understand now, but we forget about even the intricacies of that and the decision makers. When, to your point, when you're trying to help actual people, like the employees and their families who are on a plan, understand what's available to them in a manner that they can understand and absorb it, knowing that they are building widgets, teaching classes, doing what their day jobs are. They're not benefits experts, and nor do they need to or should be, but at least the information should be shared in a way that they can understand it.
100%. It's funny. I came across this survey. I almost want to say there was a couple things that were pivotal to me when I got into this business. In the beginning, obviously, I didn't know the differences between all the acronyms and just trying to figure that out in LA traffic. But then ultimately trying to realize why does this industry exist, right? It's, after a while, after a couple years, it just felt so reactive. It felt so transactional. Hey, here's your renewal. I got it down to this rate. Stick with me for another 12 months kind of thing, right? And it just felt odd to get paid every month and not talk to a client for another 11 months, right? It was just odd to me. And so what you're saying about making sure people kind of understand just made me think of a story. It involves my mom, actually, when she worked for a clinic that served kind of the underserved population up in Central California. And I was just visiting home one day, and we were just having dinner, and she was talking about how I just asked, how's work going? And she's like, it was a really weird week because multiple of her patients wouldn't take any course of recommended action to move forward in their care, because the thematic issue she was running into was that they either didn't have insurance and didn't understand how to get it, or didn't thought that it was just going to be too expensive. There was just massive assumption that, hey, whatever else thing you need me to do is going to cost me an arm and a leg, and I can't afford it. And I'm sitting there just like eating and just thinking, man, someone should explain this stuff to them.
Yep.
Right. And I'm like, who understands benefits that could explain this to them?
Was that you volunteering for the job?
Well, I didn't realize I volunteered in the moment, but I was leaving Fresno that I think that next day, and forgive me because it took me a whole day to realize, wait a minute, that's what I do, or that's what I should do, right? Because I wasn't doing that.
Yep.
That's not what we were doing, and so we were just transactional. And no shade to the firm I worked for or anything like that. I think that's just the industry dynamic. And so during my multiple hour drive home, I was just thinking to myself, maybe I can kind of practice this. So I called my mom and said, hey, is there a day I can come just sit in your office, and anytime you have a patient say anything like they said to you, maybe I could just talk to them about their situation. Maybe I can help point them in the right direction. I'm going to look up some government programs or things like that, and see if I can help them. Or if they have their insurance card with them, I can call their insurance and try to get their SBC or whatever the case is. And I did that maybe about 4 or 5 times, and I learned a lot. I learned how simple you need to make the nomenclature as hard as this industry is. You really have to just oversimplify it for people to understand, hey, this is how much it's really going to cost you. If you do have insurance, here's the best number to call, or call me. I was kind of just doing pro bono work for a little while, but honestly, it was some of the best experience I ever had because it changed the way I view this business. Because this business, I think, is a lot of times called the health insurance industry. To me, it's the employee benefit industry, right? It's not insurance, it's the benefit of people. This is the people business at the end of the day. And not to make it a whole game about semantics, but that's who we serve. We serve people.
Absolutely.
And all these, conferences and things that we go to and talking about legislation and fiduciary responsibility, all that's important. I get that. I understand that. But at the end of the day, who are we doing this for?
The people.
It's the people. And none of them have any level of understanding that we do in how to navigate their day-to-day. So they need people like us. They need people in our industry to help them help themselves.
If we stopped anyone on the street for fun, which maybe we run this experiment and see how it goes, okay, and said, do you feel like which I have my opinion, so before I say this, I don't think the healthcare system is broken. It's broken for certain people, but it is working as it's been designed to work. But if you stop somebody and said, is healthcare working the way it should, or is the healthcare system broken? If you ask them if the healthcare system is broken, I'd say 9.9 out of 10 times they're going to say yes. The 0.01 is they're just going to say, I don't know. Yeah. But most are going to say, yes, it is. It's complicated. They could potentially give an example of themselves or a family member who has struggled or had problems in either getting coverage, getting care, or whatever it is. If you ask any of them, how can you be a part of fixing it? Or how should it be fixed? I don't think most people could answer that question. And we have to change that. We have to, there are platforms out there, and there are so many good actors in the space. There's point solutions, there's policy changes coming, there's people advocating for change at every level. But if we don't get the key stakeholders, the people involved, the employers involved, we think about it, 180 million people in this country get their coverage through employer-sponsored care. Yeah. 23 million go through the exchanges, none of whom can afford the cost of the insurance, let alone the cost share and the deductibles and the coinsurance. The cost of the insurance, they couldn't afford it unless someone is subsidizing it, either all in part. Yeah. And I don't even think most people have an understanding of that.
You mentioned something that it's a staggering statistic of the average deductible being, which is your barrier to entry to getting care or getting, or paying for care. I'm not saying getting care because I want to separate the two ideals. There's health insurance and health care, right? But ultimately, like you said, I think it's just over $1,800 as the average across the country. But the average American can't handle a surprise $900 or $1,000 bill. So you're not only paying this premium that you're hoping is subsidized, as a membership fee to buy into an ecosystem that you still can't not afford.
Yep. It's when you think about your car insurance is covering you for catastrophic. So you're thinking, I buy my health insurance, it covers me from catastrophic. But you have no idea how the policy is set up and what the mechanics are and the full understanding of the benefits. I'm blanking on the source of the stat, but I just saw a study is that most Americans don't even have $500 put away
100%.
To account for any type of emergency, let alone some sort of medical emergency. So when I feel like, high deductible plans were created as like a mechanism of consumerism, but unfortunately, either unintended or intended consequence has been deterrence of people using care. Because if they go and get hit with the bill, they go into medical debt or potentially face bankruptcy, depending on the size of the deductible or whatever it is.
Yeah.
If people can't, they have access to something that when they do access it, they can't afford what they have to take on themselves.
You mentioned something interesting. So the deductible play per se. And I know there's varying opinions on it because I've talked to advisors who say deductibles are terrible. And I talk to advisors who say, I like high deductible plans for certain reasons. I think, I'm sitting in the middle because I think it just depends on the family's situation and the level of utilization that family expects to have. And I'm still a big believer that people should have choice, but they should have informed choices. So what tends to happen is employees are presented with one or multiple different plans and they have to digest what is the right fit for them, right? And now, with AI and multiple different point solutions, like you were saying, there's decision support tools that can help do the calculations, things like that. And you can get an idea of which plan is the right fit for you, right? But at the end of the day, the plans are still expensive regardless. And I get the idea of having a high deductible health plan because the idea behind it is behavior change. Hey, I have a lot of skin in the game. I'm not just going to go to any single doctor out there. I need to make sure I'm actually shopping for care. But the thing, what we're missing is teaching people how to actually shop for care and providing them the tools and the cost transparency ahead of time. Because when high deductible health plans became kind of a thing per se, I feel like the gloss just got ripped off when those plans were implemented because people forgot that they're paying a slightly lower premium for those plans. And then they get hit with the sticker shock when they go and see the doctor because they weren't taught how to seek care. They're like, hey, you get to shop for care now. Okay, how do I do that?
Yep.
How do I shop for care? Is there an Amazon for doctors? Yep. At the end of the day? And so, fortunately, there's many more point solutions that exist now that account for that. But I also see the argument for having little to no deductible because then it's not a deterrent for people receiving care. Similar to the story of my mom, right? If someone had a $5,000 deductible, the likelihood of them seeking care is slim because they're afraid they can't afford that particular bill.
Until it's catastrophic.
100%. Until that's the only option they have.
Yeah, what you said was perfect. They have to have choices and informed choices and understand what they have access to, right? You have it is situational too, because if you have an advisor that's predominantly higher paid, white collar types of clients, if you add a deductible on that plan and they have a health savings account that accounts for at least a portion of that, they can do that, and they're going to get on the app and they're going to search for stuff and they're going to pick who they're going to pick and they're going to pay more if they want to pay more. Versus if you have maybe a population that is predominantly minimum wage. Yeah. If they have a high deductible of $5,000 as their plan offering, it's going to be very difficult for them to be able to afford services unless you're pairing on things like maybe it's a variable copay plan that if you go to certain providers, you'll have a lower copay or cost share versus others you won't when you're in kind of that deductible phase, if you will. But are they going to be able to go on an app and look up what they want and what tool's being used? Is it a carrier-owned tool that's steering everybody into their own providers?
Yeah.
Or is it an independent tool that's actually going to tell them who the best doctors are with the right outcomes for their specific condition that they're seeking? And maybe it's even do we take, there's that for like, the catastrophic care, contrasting to like getting into a car accident or whatever it is. Right. And then outside of that, having a direct primary care solution that isn't an additional cost to them. Like it's almost worth, I would argue it's almost worth doing that in all of these scenarios so that people can still get access to care that they need, like maintenance care, preventative care, urgent care, and then you have kind of the other component of it. I feel like they have to have choices, but it's putting it, and then you think about the employer too, right? In that scenario, if they're getting 40, 50% increases year over year, and they want to even try to continue offering coverage, maybe they do have to put a $5,000 deductible in place, or it's no benefits, or it's laying off their workforce because they can't take the increases. There's so many forces working against everybody in that situation.
It's cyclical too. And gosh, it can go so many different ways with that. It's, it brings me to the point where why do employers offer, medical plans and in the first place, right? And, I take it back to the definition of employee benefits again. It's the benefit of being an employee. It's not just medical insurance. It's not just dental insurance and whatever the case. And so as employers, I believe that you offer benefits as an intentional tool to, breathe life into your corporate culture, but also help people in their personal lives so that they can bring their best selves to work each day. But what that means is not just offering them a plan and an insurance card and say, hey, go out and do your own thing. And we give you all this choice. And sometimes choice is like analysis paralysis. You're like, I don't know what to do, right? I'm the king of analysis paralysis. I will analyze something until I'm blue in the face. But
me both.
Yeah. And so if I had, 20 different medical plans to choose, I would never know which one to choose at that point. But going back to the kind of the employer focus on that, I believe that it's an intentional, it should be almost a responsibility to make sure that the benefits you put in place are truly intentional. So you're understanding where every single dollar is going. You are taking the time to make sure that you're not surprised by renewals year over year. I think that's a common misconception in our space. We as employers, but also I think advisors too, we are collectively making 12-month decisions as if your business isn't going to exist 12 months from now. The idea is your business is going to exist for quite some time, right? So why don't we plan for that?
And there's no other expense of this magnitude that they manage within their business that operates this way. Yeah. When we are talking about, like, especially in the California market, predominantly, which it's changing, and you're a unicorn when it comes to this, so we'll get to that in a second. But it's predominantly fully insured, maybe a little level funding, self-funding starting to emerge with the right protections. And employers have this perception they've accepted because they've been sort of trained by the carriers that you're not going to get any data. You'll maybe get a large claims report that will justify a high increase. We know where trend is. We know where it's going this year because that's been released. So we're in that kind of the hardening market or the higher renewal market right now in that scenario. And there's no other expense of this magnitude that employers have accepted that they're just going to take these increases and try to absorb and move forward without any data line of sight or anything to do anything about it. And that's got to change. It shouldn't be 12-month increments. We got to help people pick up their sight lines to see how they can plan for the future. And the structure of what that looks like is different by employer, their risk tolerance, their objectives, as you outlined, like how they want to, I think you said, breathe life into the culture of their company. 100%. What do they want to offer their people? How do they want to grow their business? And people are going to be a part of that. What would you say is like if you could distill it down to like one thing or a few things that you think would be important to share with employers to help kind of them down that education path on how to make decisions when it comes to their workforce and their benefits without, how do we get them out of the 12-month increments?
A few things. First of all, you don't know what you don't know, right? And so, lean on your advisor as much as possible and don't be afraid to challenge your advisor as well. I mean, your advisor is not your dictator, right? They are advising you for a reason, and you've hired them and you're paying them for a reason. And so, lean on them as much as possible. And I would say that don't let renewal time be the only time you're educated on the industry. Because like you said, this is the one of the biggest line item expenses that employers go through outside of payroll, right? And so with that in mind, you've got millions and actually trillions of dollars in this industry. We need to learn how to manage it better. And it takes everyone as part of that ecosystem to make sure we're all on the same page in doing so. I believe that as advisors, it's also our job to challenge the client's thinking in things. So when we come across an employer who is, going through, their learnings and thinking, I'm just stuck to this. This is, I'm painted into a corner. This is just what I got. Just give me the best deal I can get. I think it's our job to kind of expand their horizon to not just what's easy, but what's doable, what's possible. I love the old slogan of Adidas because it was like impossible is nothing. And I just honestly will never forget that because it's so true. It's the amount of times we've had conversations with employers who are like, no, you can't do that. I'm like, yes, you can. You can have transparency into your plan as a 75 life employer. You can, alter how your employees access care from one provider to the next. You can create control of that. You just have to make sure your ecosystem allows you to do that. Right?
Yeah, I feel like there's such a negative connotation because of how it's always operated in the 12-month increments, and you can't plan financially outside of that. And that it's almost like the carriers have trained employers to think they have to accept that. And it's the apology tour. It's like, oh God, the renewal is about to come out, right? Yeah. And what are we going to do next? And great, okay, we can't tolerate that high of an increase. Like, go to market, find us a different carrier, flip us over, versus making the one long-term strategic decision for their health plan, maybe a little work at the outset, but they can set things up to where they can plan both for the short and the long term. And I feel like we're hitting that like watershed moment now with the cost pressures on where benefits spend has turned into this financial cancer that's metastasizing inside of organizations. And it's not a matter of if they're ever going to have to deal with it, it's when. And you know this, like when you're managing through a fully insured plan, Ed, and you're working with the carrier, they're not coming to you going, we didn't give you any data. There's a large claims report. Do they ask you like, hey, or share with you, your client's loss ratio was this is the renewal increase they deserve? No, they're going to ask you the highest increase they're willing to tolerate. What are they budgeted for? What is the highest amount they're willing to pay?
Yeah.
In order for us to put this to bed and move forward.
What does it take to get this deal done?
Yeah.
And move on to the next employer.
Yeah. And employers have the ability to effectuate control over that process and say, enough is enough. We need to do things differently.
It reminds me of, my wife and I want to say it was right when COVID hit. We were just talking about the price of groceries, and it's like, gosh, this stuff is just so expensive right now. Things like that.
The lack of groceries and toilet paper.
Yeah, what was up with that toilet paper? I don't know what it was about COVID, but that's a topic for another day. But what was interesting at the time is when we were just kind of figuring out how to put the right things in our body. We're like, we'll either spend the money now or we'll spend the money later.
It's a fair point.
So how do you want to spend it? And what I mean by that is we could make ourselves healthy now because the things we do now we'll be dealing with when we're 50, 60, 70 years old. If God willing, we're on this earth until then. And so I say the same thing to employers. I say the same thing to advisors. If the longer we push off, I don't have enough time, maybe next year, we're just lighting money on fire. And maybe it costs a little bit more today. Maybe incentivizing your employees to go get preventive care costs you just a little bit more today, but you're truly preventing your bottom line in the future. During COVID, there were so many people that didn't go to the doctor. So many, myself included, and I'll throw myself in that statistic. And I had some surprises when I went to the doctor about 3 years ago, and things that could have potentially been prevented had I sought care, right? And it just goes to the whole idea that I think employers should invest in prevention as well. So as much as we're talking about these 12-month renewal cycles and things like that, I will always agree that we need to be planning out at least 36 months in advance and kind of maybe working backwards from there. But secondly, it's breathing life into how prevention and creating a relationship with the primary care physician is one of the most pivotal things you can do. It's the cornerstone of your healthcare journey. And I read a statistic lately that I was way off in what my guess was. I thought it was maybe 18%. It's over 38% of Americans don't have a primary care relationship.
Yeah.
So what does that mean? They're probably going to the urgent care. They're probably going to the ER. They're going to ChatGPT or Claude to find medical advice. But again, there's no transparency behind the quality of the advice they're getting either, right? And so when you're not getting quality advice, you're probably going down a path that ends up costing you more too.
Yep.
As well.
It's what you're describing right now just takes me back to an example. I was speaking with an employer about, their benefit strategy, what they've been doing and the changes on their plan. And, we talked a lot about helping educate the patient, the member, helping them understand and make informed decisions on their benefits. But this specific employer has a dynamic workforce, some that are, kind of in that minimum wage bracket. And the spouse of one of their employees, because they only had one vehicle, not two, learned what to do and what to say to get, like, if their children are sick, like they had a very young infant, she would just call 911 and say the things to get an ambulance to get them and take them to the ER. And then you get bypass, wait times, et cetera, because, dire straits, they felt like they don't have any other option because they don't have another vehicle.
Right.
So sort of learning within the constructs of the benefit plan, taking on whatever the cost share was, because they had a surge in ER utilization in one specific area, which was, one of their areas where they had kind of most of their minimum wage employees that maybe didn't have the resources at home. And then they learn how to use the plan in a way that they shouldn't. Did they have a relationship with the primary care doctor? No, but they didn't feel like they had access to one either. So I couldn't agree with you more. Even from like personal experience, without my primary care doc directing care, and I've had the, opportunity to be able to work with a direct primary care provider that's a concierge doctor too. The level of care and the time that primary care doctors have too is also a part of the challenge as well.
Yeah. Can I ask you a question?
Yes.
So I'm curious, do you believe that direct primary care and concierge is like worth the investment? I'm just kind of curious your standpoint on that.
Absolutely.
Okay.
I think so. We on my own plan, we don't have, it's not a bolt-on solution.
Sure.
We just started one this year that's a virtual solution, which has been phenomenal to access. But I went through my own part of health challenge in 2024, and I went through the ER. There was something that wasn't caught at the time. And I went back to my primary to get rechecked, and she just said, "Hey, I'm going to refer you to this concierge doc if you can make time." Yeah. And I ended up fitting them in between meetings. I was going to go on an airplane, do my thing. I think it's fine. I'm good. And they ended up catching something that had I not gone to that doctor, I wouldn't be here to talk to you about this today, Ed.
I'm very happy you're here.
I am too. And so to your question around whether it's worth it, it absolutely is. But I think there needs to be, and this is going to get a little bit on the philosophical side, but I'll bring it back. There has to be a change in the expectations we also put on providers. Yeah. Because if a primary care doctor is expected to see 60 patients a day and a 5-minute time slot has 6 patients booked at the same time, however their schedules are worked in, it isn't fair to them. Versus when you have more of the, we'll call it the direct primary care models, advanced primary care models, concierge doc models, they have time. They have 30, 45 minutes to spend with each patient to understand what's going on, connect the dots, catch the, maybe medication interactions because they've seen 3 specialists and no one's talking to each other. They have the time to be able to actually be there for the patient and help them through the process. Not only does there need to be better access to primary care through whatever format, we also have to shift the expectations that are being put on doctors today because they're not being set up for success to actually being able to care for their patients.
Could not agree more.
In traditional models.
No, I agree with you big time. And then there's also, you look up providers online and they're not accepting new patients, right? And so it's also just tough to even find those providers, even if it is more of a transactional relationship you have.
Or you call and they retired 10 years ago and they no longer are part of that practice.
It's like, oh, our directory's updated.
The ghost directory is.
Help, please.
I know.
Yeah.
We don't make, by we, I mean the industry in general, healthcare and health insurance isn't easy. And even for those of us that would be considered experts in the industry and know how to advocate for themselves and can, have a knowledge base that's probably more than 90% of the population, still need help going through it. So what does an individual who isn't in the benefits industry or isn't in the healthcare industry, or even vice versa, right? Because we've helped clinicians and people who are on the healthcare side of it with the insurance aspect and vice versa, right? If it's that hard for all of us, there's got to be some form of a reset on both sides.
100%. Candidly, I'm not sure how to reset it just yet, but one of the things I do know that we need to become better at, and even myself, I'll put my hand in the hat there too, is helping employers understand that implementing a direct primary care or concierge care type of solution, I think we can all agree that the quality is there, right? And you said it beautifully yourself, just the amount of time you have, the bedside manner of some of these providers too, you don't feel rushed as well. The other thing I'd say is too, is the peace of mind that patients have, knowing my appointment's going to be on time, right? I'm not going to wait an hour for a 5-minute appointment. I'm going to wait 5 minutes for an hour or a 30-minute appointment, right? And I'm going to get the care that I actually deserve and I need too. That speaks leaps and bounds for people at the end of the day. But I think to even get to that point, we need employers to understand that it's not just a cost. This isn't just an additional line item expense you have. This is an investment in your people. It's an investment in your health plan and the future claims expenditures you'll have as well. Yeah. You're capitating the cost, of course, with the membership fees, but from a financial perspective, but also just the quality of care your employees get.
Yep.
It's just a whole level up different than what we receive just traditionally. 5 minutes of care is not enough for people to really understand the right course of action and move forward.
Yeah, and it goes to the heart of, when you look at the Kaiser system, and granted, I haven't been on a Kaiser plan myself in a long time, and I wouldn't, and would never go near it again. You couldn't pay me $1 million to do it. I mean that very respectfully, maybe. But the way that their system worked, or at least my understanding of how it still works today, is you don't have to think a lot.
Yeah.
You go in or you call or you go online, and if your primary care doc isn't available, they're going to route you to somebody else. You go through the system. They route you to their pharmacies. It's easy to access care, and there's not a lot of friction during that process. You're not calling a bunch of places. You're not trying to figure out whether a doctor's in network. It takes the work off of the member or the patient and steers them through. Now, it's great if you aren't suffering from any sort of chronic disease or a health challenge, right? Because we see a lot of in our market, the adverse selection thing, right? When another carrier is alongside a Kaiser plan, people will try to hop between plans if they end up having a sick, chronically ill family member on their plan, or they get chronically ill. They want to access the best specialists in the field. A lot of times they are not a part of the Kaiser facility and they flip. But what Kaiser does makes it very easy to access care and takes out some of the friction in it. So there's something, I think, to be learned from the ease of use standpoint. The quality of care exists in certain areas. Getting to the right care at the right time and getting the right diagnosis from the right provider is, I think, the challenging part of navigating the other side of the system. A lot of times in a fully insured or level funded setting, the carrier is telling the employer or the advisor through the advisor to the employer what solutions they can access, what doctors they can have access to based on their network, what network offering is there. And I'm a big proponent of self-funding, as I know you are, Ed, because you are a unicorn in the Southern California market, and how many self-funded clients you manage, how many employers you've taken self-funded. What is like your perspective on helping, because you said this earlier on how you talk to your clients and prospects about prioritizing it now, or you're just burning money till you defer it to when you have time to deal with it. How do you get them to make the shift? I know it's probably different by employer,
Sure.
but getting them to prioritize it, because I've seen you do it very successfully and more so than others have. So especially in the dynamics we deal with today here.
I guess I just keep choosing hard things. Everything
Adversity
I do
builds character. There you go.
So, yeah. No, that's a fantastic question. Where do I even start with that? For me, it took a while to get to this point, but I believe, and I think I said this earlier, that it's our job to challenge the thinking of our employees. That doesn't mean you have to argue with them. That's not what I'm saying. What I mean is to just expand their horizons, and meet them where they are. You're not forcing them in anything either, right? And I also, I learn a lot from a ton of advisors that I met nationwide. I will always ping them and say, hey, how do you handle a situation like this? Or how do you help this type of personality understand what I'm trying to say, right? And because all I'm trying to do is educate. I always say this, I use a sports reference to clients. I'm your offensive and defensive coach. You are the head coach. But I'm going to own the outcome with you. I'm going to be on that sideline with you, and we're going to try to win this game together, right? And that's the mentality I want them to have going into any type of education we have. And then again, I want to have these conversations outside of renewal time. I want renewal time to be targeted on, we know pretty much within a given margin what we're going to do. We may be a little surprised by some of the renewals here or there, but at the end of the day, from a strategy perspective, we understand exactly what we're going to do. And it took me a while to realize that after a renewal period is the perfect time to start having these conversations. Let's debrief, have a postmortem per se. And can I share with you some ideas that I have that I think would work for you? But again, I'm not going to force it to you. But can I also show you one more thing? People understand exponential growth, but it's hard to understand it until you see it, because I think, from a mental perspective, you see exponential growth as just this straight line that goes up, but it's a curved line, right? And so when I started really focusing on helping employers take control of their health plan, one, I stopped using the term self-funding as much, because especially in California, when people would hear the term self-funding, they would just run for the hills. No, I'm not doing it. Don't talk to me about that. That sounds like way too much work. I don't have time for that stuff. And so I would just change the way I approached it to, hey, how would you like to create a budget or turn your health plan into a controllable asset? And then and I would speak differently to the HR team, who are very focused on their people, right? Who are technically wearing so many hats. I always believe HR is like the heartbeat of organizations. And I talk more about the employee experience with them. Just saying, hey, how would you love it if your employees were able to go and get a second opinion from a top-rated doctor and then also pay nothing? Would you like that? And, just go down the line of just creating this wish list of employee experience wins that HR gets to take the credit for. And then for the CFO, I just say, hey, can we, turn your health plan into a controllable asset? How would you like to create a budget where right now it's just a line item expense? You can't do that when you're fully insured, but you can if I'll take a quick step back. I'm a big Simon Sinek fan. And so the whole start with why, his golden circle rule, and so that's the approach I take into consulting to a degree, because I feel like if I walk in the door and say, okay, let me walk you through this self-funded plan, people will be like, okay, this is going to be a bunch of spreadsheets and numbers that I have to figure out how to understand. Or I could say, hey, here's the problem I see in healthcare access today. And here's where I believe the employer responsibility lies. Here's where my responsibility lies for you. And how would you like to change that? What kind of experience do you want your members to have? What kind of experience do you want your CFO and your finance team to have? Hey, good news, we can actually do that by doing this. Unbundling your plan, putting these kinds of mechanisms in place, putting more transparency to your pharmacy program, whatever the case at that point. So that's my approach, honestly. It's just changing the way I talk about it. It's less about the product and more about the mission.
It's explaining benefits to them in a way, and health insurance in a way that they can absorb and understand it and apply it to their business after understanding their objectives, their needs, what they're trying to achieve, and marrying it together. I've always, throughout my career in benefits, I've always enjoyed the part of it when we can use the benefits as a way to answer their business needs.
Right.
If they're feeling financial pressure in other areas and you can help them here and take some of the lift off, and granted, taking them what we call self-funded, or maybe turning it into a controllable asset for them, allows them more flexibility to make those benefits better.
Right.
And they don't have to choose between saving and benefits, rich benefits, any longer if they start to break apart the components with the right advisor who's walking them through it. So I think what you said is beautiful, because it truly speaks to the heart of helping them understand and absorb and doing what's right for their people and their business at the same time.
I think it also allows us to understand where they are in that journey too, because you may have people who are just ready and maybe they're pretty informed on how this stuff works, or they're at the absolute beginning stage of it. And so you need to really, get to the root of what makes them tick. What are some of their real goals at the end of the day? And then also just relate it to their business. Like you said, what are some other business objectives that you have? And we could, again, kind of create a budget around this. One of my favorite wins, if you will, is an employer. They were actually my first ever prospect meeting when I started this 17 years ago.
Is this the drive in LA where you were learning what an HMO and a PPO was?
No, that was a client meeting, but this was a prospect meeting. This is a company my dad actually works for. And it was funny. They gave me the time of day because my dad works there, of course. And, at the time, I didn't know what I was really doing, right? And so they said, talk to us when you know what you're doing. I waited like a whole decade and then finally got back in front of them and had more of this energy around unbundling and, creating a really solid quality member experience, and related it to their business. They're in the agriculture space, but because they're in the agriculture space, they have a lot of team members who maybe are low income earning. So the affordability of plans is really key. And then also access to care and understanding how those plans work is really key too. But in addition to that, agriculture a lot of times can be low margin. So they need to create budgets where they can. And so I remember walking into this office and listening to some of their goals and how they really want to take care of their people. They had been part of an association health plan for 25 years or something like that, taking, like you were saying, 15, 20% increases. I mean, how would you continually paying more and more for arguably worse coverage because their deductibles and copays were going up too, right? It's just frustrating at the end of the day.
I feel like arguably a lot of employers are probably at a breaking point because their benefits have gotten so lean and they're paying so much for it.
Yeah.
What are they paying for anymore?
And then we have to sit there at open enrollment and be like, look what we have, guys. Hey.
to the firing squad you go.
Yeah. Oh man, I need a bulletproof vest sometimes in some of those meetings. But one of the things I noticed when I was driving in was a couple mechanics working on a tractor. And I asked them, I said, how much are some of those tractors? And they said, oh, it's around, $150,000, something like that, these really big tractors. And I said, how often do you need to service them? Is it expensive? They're like, oh my gosh, it's so expensive. They break down all the time, blah, blah, blah. And I said, how would you like it if your health plan could not only, provide the right care to your employees, but also create a budget so where you could buy another one of those? And they said, that's impossible. I was like, well, let me show you how. Because right now what you're doing is you're sacrificing all the tractor repair care, if you will, by this exponential line. I ended up showing them kind of a grid of what that line looks like. And fortunately, they ended up understanding and they took a leap of faith, and they're about 4 or 5 years into their plan now. They've had like 3 or 4 decreases in cost in addition to all the claim savings they've had along the way too. So that's been one of my favorite missions. And what I love about this employer is they're just now, because they've taken this leap of faith, they're so bought into challenging the status quo. They will reach out to, sometimes I feel like I'm not doing my job because they'll reach out to me and say, hey, what else can we do? Have you heard of this idea? But that's what I want. That means that this whole relationship is a win at the end of the day. If you have your employers reaching out to you saying, hey, I came across this. Is this a good idea or bad idea? And they feel safe enough to come to you with those and you can collaborate, and maybe it is a great idea and you implement it. I mean, that's what you want, that collaboration.
Yeah. And they trust you, right?
Yeah.
Because you took something that was something that they probably avoided or ignored because they didn't want to deal with it, except for when they had to go on the apology tour or whatever it is every 12 months.
Yeah.
And you turned it into something that was tangible for them and how it could impact the rest of their business. Use the benefits to solve a business need, reduce costs for them so they could maintain their tractors, potentially invest in more, and grow their business as a result. And like watching you talk about that right now and how you lit up, Ed, and getting to do that for them. And then them now they see it and now they're all engaged, right? Instead of avoiding, deferring, I don't have time for this. I got to look at other things, or we got too many other business pressures, or we're changing our admin system so we can't think about anything else. That's the fun one for me. Just to hear you say that and they trust you and then now they see it and they're engaged, like those types of clients and those types of employers to work with are the best ones, because we gotta create that dynamic across the board and help them see what they can truly do by doing something about this. And on the flip to that, like, what is the benefits offering like to their people?
What is it like?
Better now, right?
Yeah, fortunately, we're able to reduce some of the barriers to entry. Like some of the deductibles were fairly high. They were able to reinvest and lower those deductibles. We put in, virtual primary care, virtual urgent care, and all those virtual resources that employees didn't have access to before, at no cost. So we educated members on doing that. And it's funny because my dad works there, my mom is on the plan, and I let them be the guinea pig on some of the things I was trying out. So I'm like, hey, Mom, can you just try the virtual care out for me real quick? I want to make sure it's like working. And fortunately, she was more than happy to oblige. But I also, speaking of my mom, got to see this motion in practice because it saved my mom's life. So about 3 years ago, we were hanging out for Christmas, and her energy she's always a calm individual, but calm doesn't even begin to describe her energy during Christmas. Like, we're all outside playing with the kids and she's just laying on the couch, and just everything was just really low. And so, I kept asking what's wrong. She's like, I don't know, I'm just really tired, really tired, really tired. And so she ends up going to the doctor and taking blood tests and things like that. And they just could not figure out what's going on with her. So fortunately, because of this, honestly, this industry can be awesome. And the people you meet, I ended up meeting a fantastic nurse from specialty care management, Kimberly Langford. I don't know if you know her, but she helped me through a tough time because the doctors were thinking that she probably needed dialysis, which is crazy expensive and also incredibly uncomfortable for her. But they still weren't sure. So she was just going after getting biopsy after biopsy. I think it was like 3 months in a row of just going to multiple different doctor visits. And then, of course, I finally remember I had this second opinion process built into the plan. So I activated that. And again, and this is what I say about you don't know what you don't know. Like, even sometimes I forgot what we implemented for this employer, and we activated that. We ended up getting this super high quality department in Stanford who focuses on kidneys specifically. And within 24 hours, we're able to immediately diagnose my mom. They realized that the primary care physician that she had at the time had her taking 2 medications that were counteracting her blood cycle. And it was basically a slow death. And she was days away from just coding.
Oh my God, Ed.
And sorry.
I think it's amazing that you got to put something in place that helped save the life of your family member too.
It may seem easy to take credit for that. I don't even take any credit for that. I thank the employer for taking the leap of faith in that. I thank all the people in the industry I've met who've taught me what I know now, because I think it takes a village for this all to change. Sorry.
I'm really glad she got the right care when she needed it, and that they caught that.
They did. And then now she's, they ended up diagnosing a certain stage of CKD, but she's basically completely out of it now.
I'm so happy to hear that.
When I talk to her on the phone now, she just sounds so much more jovial. And I'm like, how's the doctor appointment? She just went, she goes, oh, I got to go see my doctor. It was a great meeting. We just hung out and it's just so cool. Like that could have been completely different if the ecosystem wasn't there to support her. Right.
It's a big deal. I'm so glad your mom is doing better. And
Me too.
it's so meaningful when we get to like help, make a change and make a difference in someone's life. And especially when we're helping a family member or anyone for that matter. And there is, that is the beautiful part of this industry is we get access to folks and hopefully remember the right people to pull in at the right time to get access to the right resources.
100%.
And unfortunately, not a lot of people are as fortunate to do that. So any difference we can make and just even Ed, listening to you talk about when you reach out to other advisors to run things past them, like we are, competitive by nature but you are reaching out and like rising tides are lifting each other.
100%.
You're working with Second Opinions, Point Solutions, Kimberly Langford, other advisors who we're all trying to do this together and make this better.
Yeah.
And I just love hearing the example of having all sides of the changes. And to your point, like the employer did the right thing there and did what was best for their people. And that is illustrative of with the outcome that your mom had she not had access to those solutions, who knows what the outcome would have been. And hopefully she would have gotten to the right care. But
Right.
I'm
glad we didn't have to go down that path though. Yeah.
I am very happy you didn't either. Yeah. And, there's so much of, people ask, decision makers within companies ask, like, how do you put a return on, what's the ROI? Mm-hmm. What's the return on investment for putting the solution in place? I think that one's priceless.
That, and also, sometimes I flip that question on its head. A lot of times I said, well, inaction is also a decision. I mean, choosing to do nothing means you can't complain when you're getting significant double-digit renewals every year.
Yeah.
Right. You have to be willing to get uncomfortable to get comfortable again. And that's something I had to learn too, because, I grew up in this industry thinking fully insured is great and self-funding is way too hard, especially, I have a California employer fully insured. Oh, here's this, shiny whistle of being level funded now at the end of the day. And so, you go through and, fortunately there's these networks, like you were saying, rising tides lift all boats. And I'm so happy to have much of that mentality now because there's these groups that exist now. There's, Next Gen Advisors, there's, you guys do these members meetings, which is amazing. And, True Network as well. There's tons of them out there. But what I appreciate is you'd be sitting next to a competitor per se, but really they're just a comrade that we're all trying to accomplish the same thing. And we may be from different parts of the country. And the idea is we're learning from each other to try to make this whole system much better. And so that's why I see it that way rather than trying to see everyone as competition per se.
Yeah. It's going to take everybody and then some.
Yeah.
To effectuate any real change in hopefully our lifetimes.
Yeah. It seems like such an ambitious goal. That sounded
really depressing,
it's
the
true.
direction I took it.
Well, it just continues to feel like we're going in the wrong direction, right? I mean, you hear, sometimes I work with employers that have their C-suite or their HR teams are from out of the country. And so not only do they not understand the American system, the cost of it is just something they just fall out of their chair about every time they see it on a spreadsheet. And so, think about that versus other countries. And again, this isn't to get political or anything like that. Other countries have their own pros and cons in the way they handle healthcare. But it's obviously something that needs to be addressed here at home. So
yeah, I couldn't agree with you more. How, what would you say kind of sums this up for you? Is there like a quote or something that's like meaningful or any other part of the industry that you feel like needs some level of change?
Yeah, not to get overly philosophical, I think of a couple things. First and foremost, just health insurance is not the same as healthcare. There's a significant difference. The health insurance is a means to an end. Healthcare is what impacts people and outcomes at the end of the day. And I think by having that mindset going into planning for your benefit plans, I think will change everything, because starting there will get you out of that 12-month cycle ongoing along the way. So that's the first quote I could think of. Yeah. And then, secondly, just understanding who your demographic is at the end of the day, because we can all agree that not all, people, as people are necessarily like created equal, right? And so same thing for doctors and the way they handle care for people. Mm-hmm. And so, this is also hard for me to bring up, but it's something that happened, in 2021 was a big year for me personally because, or professionally, because I ended up getting an award of Broker of the Year, and it was amazing. And I'm still so thankful for that honor.
Well deserved, Ed.
I appreciate it. I didn't think so at the time. I had such imposter syndrome, for sure. But, as much as I was getting a lot of congratulations from peers and some people I'm just now meeting, and because of that, I got to meet so many incredible people too. And I think that's how I got to meet people to learn how to do this business better. But at the same time, I was met with just a whole other layer of adversity I unfortunately was prepared to handle. Because of all the social strife that was going on from COVID, there were certain people that came to me and said, "Hey, don't you think you got that because of how you look? Don't you think you got that because you're Black?" And I wasn't prepared to answer that question at the time. I was pretty shocked. I mean, I was overwhelmed about the whole situation in the first place, but that question happened more often than not. And it wasn't just from one demographic group. It was from all over the place. And I didn't really share that with anyone other than my wife, to be honest with you. And I just kind of kept it internal. And then what I wanted to do, instead of kind of lashing out and being negative towards those people, I wanted to see if I could find a way to redirect that energy, because one, I'm just a non-confrontational person anyways. And so I tend to shut down in situations like that. I've taken the stance of trying to educate and understand first. So when I was receiving feedback like that, I decided, okay, well, clearly there's a disconnect to how much I've worked to get to this point and what you perceive I deserve, right? But that also makes me think about anybody who, whether it's a gender or a person of color, and when they seek care, what type of care are they actually receiving? Because we all come from different parts of the world, even though we're all sitting on the same land right now, we all have different biological needs and we're all predisposed to certain things as well. I still remember a case from, I think it was 6 or 7 years ago or something like that. There was this young African-American child in my hometown of Fresno who was going to every doctor, couldn't figure out what was wrong with him. And then he finally went to one doctor who, of African descent, and realized he had sickle cell disease.
That's what he found it to figure it out.
Yeah. And it makes me think about how often misdiagnoses may happen just because, and it's unintentional. I'm not saying this isn't a doctor problem per se. It's just these things happen. I mean, another stat that always blows my mind is Black women, as an example, pass away 3 or 4 times more often than any other culture during childbirth. And these are just the numbers, right? And so
I'm trying to first, I'm just angry in general on some of the things that you just mentioned. So let's try to unpack this just a little bit.
Sure.
People have biases, whether they mean to or not.
Sure.
But for anyone to approach you with who doesn't, I would assume a lot of these people did not know you well, if that's the assumption they took when
Very much so.
You won that award, which is very disappointing, and frankly, shame on them. And it's hard for us as coming up in sales and becoming sales leaders and, working hard, coming from points of adversity. You've experienced things in your life where people have cut you down, and you've worked through and started from points, even what you described earlier when we started out, the injuries that you had and how much harder you probably had to work with the, factors that were working against you.
Yeah.
And to have people then minimize your accomplishments don't even deserve a second thought from you. And it's really disappointing and frankly disgusting that that still exists in our culture today, that people would make an assumption that barely know you, that you won an award based on the color of your skin. But to your point, we're seeing like that still exists. I think we should talk about it more. I think the more awareness that's drawn to it can help people maybe catch themselves or go, maybe it's something else outside of the general course of what I see as a practitioner. Maybe this child, maybe we should test them for sickle cell or something that could be something that I don't really think of because in the general course of things, I don't have a lot of African-American patients, or I didn't think of it differently.
100%.
But even like if you dive into the statistics around how many, African-American women die during childbirth,
Yeah.
Is that something that we can help prevent or start to effectuate or do something differently on? And I think it's people have to address their biases first. And
look at things objectively.
Yeah.
It's not about you. And yes, I know you've gone through 10 years of school and however much experience you have, but at the end of the day, I always believe that I shouldn't be the smartest person in the room. And like I was saying about reaching out to other advisors and trying to get advice on things and things of that nature, I think as practitioners, and I think this can kind of go for any industry for that matter, should be humble enough to realize that maybe, I don't know if this is the right term, but feeling a little out of your depth per se, but maybe someone has better experience in this particular arena than I do. Right. And
check your ego. And it doesn't matter what color, what gender, what path of life. If they have experience in an area, we should tap into our network and help them lift each other up. And, I know what it feels like to have imposter syndrome. And, not an example of that magnitude whatsoever, but we talked about this before where, in, posting more content or putting more things out there to help educate and get the word out. A lot of women have reached out over time and said, hey, it's inspiring. I suffer from imposter syndrome. How do you keep yourself out there? And when people have negative feedback or let their bias, whether it's unconscious or conscious, dictate how they're going to approach somebody or take a position to judge somebody based off of their own bias, that's something they have to work through. You and others we work with consciously check our egos to say, I'm going to access my people. I'm going to see if we can figure out a solution. I have my go-tos. They have go-tos. Like we can try to figure this out. I'm not going to pretend I know everything, but I know I can access people who can help get us to the right spot, hopefully, and do the best I can in the process. And frankly, like that's what makes you great at what you do, Ed. And that's why people love working with you. And if we weren't on record, I'll tell you what I think off record, really. But like, I wouldn't give a second thought to what those people said, because I can guarantee you, if you look at a measure of their success on where they are, not that we're going to take a position of judgment, I would think that there is some level of jealousy and other things that are dictating why they would even think to say something like that to you. I do think the systemic, challenges we have in the healthcare system that are driven by, people's biology and other things, there are things we need to do to help change that too. I don't necessarily have the expertise in the area, but I'm sure we could find a lot of people who can.
I think a lot of it just starts with awareness and then also the willingness to understand.
Absolutely.
And like you said, checking your ego at the door per se, and realize that the mission of whatever relationship you're building with a patient or a doctor, whatever the case is meant to have a great health outcome at the end of the day. The goal is for them not to need to come back to you.
Absolutely. I'll tell you, Ed, you're one of the most inspiring people.
Oh, I say the same about you, by the way. So
I appreciate you. And every time I get the opportunity to sit down and chat with you and just get to know you better, I just am like so impressed and so appreciate you taking the time and sitting down and sharing this. And hopefully this will be a good format to like get the word out, get people thinking differently, and really help effectuate change. And I just love your philosophy on advising, and hopefully we can help some more employers out there as a result of it.
Yeah, absolutely. That is the goal. Excited to be here and keep waking up and trying to do the right thing. So,
Thank you so much, Ed. It was great having you on.
thank you for having me. I appreciate it.